Living Clean is a presentation of the Canadian Centre for Abuse Awareness and is brought to you by Turning Point Detox.
Good evening, everyone, and welcome to Living Clean, Living Well. I'm Teresa Cruz, your host, and we're very pleased to have with us in the studio live tonight Dr. Vera Tarman, who is the medical director of Renaissance. Hi, Dr. Tarman.
Hi.
We are so privileged to have some of the best in the business join us here on Living Clean, and we're so glad to have you. I'd like to talk a little bit about Renaissance and what it has to offer. I understand that you just celebrated your 40th anniversary at Renaissance.
That's right. We celebrated last year, but I'd like to say, first of all, thank you for inviting me to come up here and speak. I love speaking on the subject of addiction, so I'm really grateful that I've had this opportunity. Yeah, Renaissance has been around, we celebrated 40 years last year, and apparently we celebrated our 40,000th patient or client as well last year too. So yeah,
And you have a high rate of recovery, I understand. It's wonderful.
Yes, yes, providing people follow through with the program and then follow through with the aftercare afterwards. And then Renaissance is very much based on a 12-step program, and providing people follow through on that. It's a very high success rate.
I loved seeing some of the background. I've known Dr. Ed Yielding, who was the medical director at Renaissance for years, but I understand that it was a group of businessmen that actually got Renaissance going?
That's right. About 40 years ago, it was around about 6 or 7 businessmen who wanted to have a center that was dedicated to people. At that time, it was most likely primarily alcohol, probably some prescription medication as well, addiction, that wanted to get together and form a treatment center. And since then, it's expanded to it's far more than just businessmen now. It's 3 houses, 3 treatment centers. 2 for men and 1 for women, of people from all walks of life and all ages that come in, and now it's far more than just alcohol as well.
Absolutely.
Yeah.
What are you seeing as medical director? What are some of the big challenges that we're facing out there right now as far as addictions and substance abuse and things like that?
Well, it's alcohol for sure is number 1, but right behind it, I'd say it's almost 50-50. We're seeing a lot of stimulant abuse, primarily cocaine or crack. And it's interesting because alcohol is more the older generation and cocaine, crack is more the younger generation. And what we're really seeing now, and this is across the board in addiction medicine in general, is polypharmacy. People are not just addicted to one thing now, they're addicted to another, several things. And so that our treatment centers now have to be aware of models that are not just focusing on one substance. Because what ends up happening is a person stops one substance and substitutes for another. And we need to have a way to deal with that.
I'd like to talk to you a little bit about your background and how you got into it. I understand that you started off being an MD.
That's right. Yeah, I was a family doctor, and I was a family doctor for about almost 20 years. And with family medicine, pretty much any family doctor will tell you that a lot of their work is mental health care. And within that subset, there's a lot that's addiction. And I just found that I was really drawn to that work more than I was just general family medicine. Then when I started to get my certification, I found that I really liked the science of it as well. So I just decided to become a specialist in that area.
I love hearing that word science. Because there is a definite science behind everything. It's not a problem. It's not a failure in your life, right?
That's right.
That only happens to certain people. There's science behind this.
Yes, that's right.
Can you expand upon that?
Well, if you're talking specifically addiction, or
addiction, yes.
The science of addiction is new. I mean, the science of medicine isn't new for sure, but addiction itself, it's fairly new. The American Society of Addiction Medicine is only 25, 30 years old. And the profession of addiction medicine is younger than that. We have probably 30 addictionologists. I might be underestimating, 30 to 50 in Canada only. That's it. Not very many. And part of that is because the science is now finally emerging. We're finally starting to actually show that we're actually able to prove that there is actually a disease model of addiction. And, you know, just in terms of the science, the American Society of Addiction Medicine just now in August, like last week, announced publicly that they determined that addiction is actually a brain disorder, a brain disease, and not a moral failing in the way that you were describing, because so much science is now backing that up. Yeah.
Dr. Tarman has over 20 years experience in the area of addictions. She also has personal experience in the area of food addictions, which we have had many phone calls about. I'm going to be talking to you about that in just a few minutes. We are Canada's only live interactive television show that deals with addictions, abuse, and trauma, and our toll-free lines are open as soon as we hit the air. I want to draw your attention. We do have a phone call right now. So before we delve into the area of food addictions, which I know our viewers are very interested in, because as I mentioned, we've had so many phone calls before. I'd like to open up the phone lines quickly, if I may.
Okay,
Let's go to line 1. We're going to be going to Ottawa tonight and talking to Michaela. Hi, Michaela. You're live on Living Clean. Have you got a question or a comment for Dr. Tarman? Michaela, are you there? Well, we're going to hook Michaela up, so that's fine. We're going to work through a few of our technicals right off the top, no problem at all. Yeah. So let's talk about the food addiction then. This is an area that you have really taken to heart, and I understand you have personal experience. Are you wanting to share that with us tonight?
Sure, I can share that. I mean, my interest in this area professionally now comes from two I guess, venues. One is my work as a professional in the field, and how much food addiction I see, and how poorly we treat that, how poorly we deal with that condition in the medical psychiatric model. We just don't deal with it very well at all. And my wanting to rectify that from a clinical point of view, a professional point of view. But then I have my own personal experience as well, in that, and I guess that's where my mission comes in that I've had my own struggles with food addiction, which now I would call myself a recovering food addict. I feel like I've gotten on the path that I think works, and I'd like to be able to share that with other people. And so there is hope. It is possible to not cure this, but live with this in a successful way.
That's great, to live with it in a successful way. I love the way you put that. When did the weight creep on, and how much did you weigh at your heaviest?
Well, I think that probably I started to abuse food in the way that we all do, you know, using it for comfort in my 20s and 30s. When I was in medical school, I mean, medical school is a hard slog, and my ability to eat properly and to exercise well and sleep well, forget it. The primary focus was get that information in and do my exams properly. So I would say that my maximum was in medical school, eating that hospital food. It's much better now, hospital food, but at that time it was, you know, French fries and whatnot. And I started to use food as my way of surviving the grind. And you know, at the end of my shift or the end of the night, I would have my my big bag of chips, which then became 2 or 3 bags of chips, and the big ice cream, and the big juju bag, whatever it was, just to get through. I felt I couldn't drink, which was something that I had done in the past, because I needed I couldn't be hungover the next day. Little did I know that you have a hangover from that kind of binging the next day too.
From food?
Yes.
Wow.
I didn't make that connection though. I just thought I was depressed or anxious or worried, and you know, it was medical school or internship, and that's hard slogging. Not knowing that that kind of food actually made my moods incredibly up and down. And for anybody who has any concerns about eating and has mood fluctuations, look at your diet, because you'd be surprised at how much food can alter your moods. But the picture that you saw there earlier was me at my graduation, and that was my, I don't even know if that was my top weight. My top weight was 240 pounds, which is 105 pounds more than I am right now.
And how tall are you?
I'm 5'7". I was definitely in the category of what we would call morbidly obese, which is a BMI of over 35. How I felt was it was hard to get up the stairs. It was hard. I used to like walking, and walking now was a chore. I would have a joke that I'll walk as long as I can walk to the next coffee shop, and as long as it's not too far away. so you know, we would, my friends and I would call them faux walks. They're not real walks. They're just look like walks, and they're always to one coffee shop to another. And you know, of course, a coffee shop meant a Danish and a pastry as well. It took me many years to figure out that that was not a weight that I naturally needed to be. I actually thought that I didn't make the connection. One of the things that I find very interesting about addiction in general, food addiction too, is how little we're aware of our own behavior and connecting the dots. And there I was in my graduation, having all the book knowledge right at that moment, because I've just written my exams, I've just graduated, but I couldn't make that connection between what I eat and that my weight is the way that it is. My moods is because of my eating. I thought that's my genetics, I can't help it. I didn't make that connection. And it wasn't until years later that I made the connection and started to alter it, and then was like, oh, this was just a shock, yeah.
I'm fascinated to learn more. We're going to take our first break here on Living Clean. We're going to, when we return, we're going to be taking your phone calls. And tonight, Dr. Tarman, her special interest is food addiction from what she's gone through herself. She's now 105 pounds lighter than what her top weight was. And we have had, as I mentioned at the top of the show, a lot of questions about food addiction. So we're going to explore that area. But Dr. Tarman can also talk to you about all of the substance addictions and the other addictions as well, because she is medical director of Renaissance in Toronto. And we will we'll be back with more to talk with Dr. Tarman after we take our first break, and we're going to be taking your calls as well. So stay tuned. Living Clean. We'll be right back. You're watching Living Clean live here on CTS on this Sunday night. I always say thanks so much for inviting us into your lives and your homes. We're so glad to be with you. Every Sunday night we're here. And we're here to talk about a subject that a lot of people don't like talking about. Addictions, trauma, abuse, the root core issues, those sort of things. Before the break, we were talking to Dr. Tarman about a special area that is a personal journey for her, which is food addictions. But as I mentioned as we went to break, she is here to talk to you about anything that you need to talk about. She is a doctor. She is very well versed in addictions, and she's here to help us tonight. We had a little gremlin in our system, so we've got it all worked out now. We're going to go live to our phone lines, and we are live here. The toll-free lines available for you folks right across Canada. Pick up your phone and give us a call tonight if you have a question, a comment, perhaps maybe even a recovery story that you'd like to share. So let's go back to line 1, and Michaela is calling in from Ottawa. Michaela, thanks for your patience. You're live on Living Clean. Hello.
Hello.
Hi.
Hi, how are you?
We're doing well. Have you got a question or a comment?
Yes, I have a question and a comment for
Sure.
Dr. Tarman, actually. I chose Renaissance because of the 12-step program that it delivers. I lasted a little bit over a week. They couldn't handle me because of my ADHD. The staff said I was very demanding. I told them that I was on naproxen, which was a painkiller, which unfortunately makes me go to sleep because I'm due for shoulder surgery in January. I live in Ottawa, and I don't think there are any addictions doctors here. Actually, that was one of my questions for Dr. Tarman, is if she could possibly recommend one. The groups here are far less supportive for AA and NA than in Ottawa. I almost wanted to pack my bags and move back to Toronto. I have relapsed since, and I think part of that is I've only been a crack cocaine user for about 6 years. I'm 24. There's a lots of history of abuse, mental illness in my family. I'm Native, was adopted into a white family. The whole history of psychological mess. However, I've managed to work through most of that, and, you know, I still talk to the people at Renaissance. I've been invited back to attend their program again. Have been chasing Vanjie for over 4 months, leaving her messages, and she hasn't returned my calls. So I'm taking that as a sign from God, because I do believe in God, that that door is closed. So now I have applied to House of Self-Esteem, which is more of an intense program. They deal specifically with child abuse, sexual abuse, mental abuse. Yeah, so my question for Dr. Tarman and my comment is, thank goodness there are people like you who do what you do for people like me. And, yeah, if she could give me a recommendation of somewhere to start to turn in Ottawa, because I don't want to end up dead, which is eventually what's going to happen, or I'll die of a heart attack.
You don't want that to happen. Dr. Tarman.
Yeah, no, I mean, you're so right on. Addiction is potentially a fatal illness, and you can really recognize the danger of that. And I can really empathize with you about finding a doctor in Ottawa. I mean, I was saying that to you. There's just a handful of us, or I guess a little bit more than a handful of us in Canada, and a lot of us are located in Toronto or in the bigger cities. I know that the University of Ottawa has some addiction doctors, but I don't know if they would be appropriate for you. Have you looked into the University of Ottawa Family Practice Healthcare unit?
Yeah, that's an idea.
I don't know.
Michaela, have you looked into the University of Ottawa?
Yeah, and I've also got a psychiatrist at the Royal Ottawa Hospital as well, but she's not an addiction specialist.
No. Yeah.
So it's a bit of a, you know, a running wheel.
It is. It is. And the other thing that you mentioned is that the groups are probably different than they are in Toronto. I mean, I would hate to think that a person would have to come to Toronto to get that kind of support. I can really empathize with you.
Wendy, or Michaela, I also heard from you that perhaps maybe some of the root core issues, you mentioned abuse. Don't forget the Canadian Centre for Abuse Awareness is the presenting company of this show. And there you go. We've got some information on the screen for you right now. Their 1-800 number, so that's toll-free as well. And Michaela, there might be some resources for you from the CCAA, which is the Canadian Centre for Abuse Awareness. Maybe they can help hook you up with someone in Ottawa that can perhaps help you get on a good path and maybe find some of those professionals that you're looking for. So Godspeed, and thanks so much for calling into the show tonight to talk to Dr. Tarman. We're going to go to line 2 now, and Midland, we're going to be talking to Wendy tonight. Hi, Wendy, you're live on Living Clean.
Hi, how are you?
We're well, how are you?
I'm good. Actually, I just wanted to talk to Dr. Tarman. I'll give you a little history. You talk to my husband Dave all the time, obviously.
We do, and you just had your anniversary last week, so
yes,
congratulations.
I'm 4 years clean and sober, addicted to both cocaine and alcohol. I also, in the past, when I was younger, I had anorexia, but I also now am dealing with a different food addiction. I've been put on a medication because I'm bipolar that causes me to want to eat. So I've gained 50 pounds.
Yeah.
I'm going the other way. So it's like I'm obsessed with food. Do you know what I mean? So it's almost like I have an addiction in my mind where I want to eat all the time, but it's the key from the medication as well. So I'm wondering if you know how I can help stop that.
Well, I want to say I empathize with you too. Some of the medications that are, some of the psychiatric medications are, do exactly what you say. They, first of all, they just intrinsically, one of the side effects is that a person will gain weight. But you also mentioned that it sounds like you have cravings for sugar, or not sugar necessarily, but food. You're eating more than you normally would. And it sounds like you're saying you're even obsessing about it. Am I right about that?
Yes, yeah.
Yeah. Yeah, boy. And what can I suggest to stop that? I mean, part of it is the effect of the medication, and that's an unfortunate phenomena. But one thing that you might want to consider is if what's happened, because you have a history of addiction as well, that's now you're in recovery, you said. One of the things that I see often in my work at Renaissance is that a person will get clean from alcohol and cocaine or either, and then they find that they develop a food addiction, because we don't really think about food as an addiction. We're starting to now, but we haven't been. It's really just a substitution. The behavior is the same, the obsessional thinking. I mean, is your way of thinking about food the same as it was when you were thinking about cocaine in your active addiction?
It's exactly the same. It's the way I think about when I start exercising. I'll get to that point. Like, I'll just exercise myself to death. So, I have that obsessive mind.
Right, exactly. And you know, that obsessive mind that you're talking about is, you know, we addiction doctors, I was just saying earlier, we addiction doctors have just this month in August, it came out in the press that the Addiction Society, or the American Society of Addiction Medicine has finally declared that addiction is not, first of all, a moral failing. It is a biological phenomena in the brain. It's a biological disease, and it's got to do with the actual obsessional thinking piece. It's not got to do with the drugs. So it's not about the cocaine, it's not about the alcohol, it's not even about the sugar, the gambling, the sex. It's about that addictive process that you're describing now that's come up with your food. And so what it sounds like, and you can tell me if it feels right to you, that it's your addiction that's reared its head in a different manner. Yes?
It's just a matter of going through another 12-step program in my head for food, in a sense.
Yes.
Yeah.
And so how did you stop your alcohol and drugs? You had to stop them. You had to actually abstain from them. And so it may well be, well, with the whole thing that I'm trying to promote here, or make an awareness of, is that if you are a food addict, you may have to use the same tools that you used for your alcohol addiction and your cocaine addiction to food. And in this case, you may have to find out what are your trigger foods, and then you abstain from those.
Wendy also mentioned that, you know, she's taking the
medication.
Yes, the medication,
yes,
which is going to. Does that cause food cravings?
It can. Actually, it can cause sugar cravings, because some of those medications, they actually cause a dysregulation of sugars and fats in the blood, and are therefore going to have a sort of hormonal changing effect. And so, not only are you potentially reactivating your addiction, but you're also having a hormonal effect of the medication itself that's making you want to eat more. In a sense, you've got a double whammy happening.
So we've identified what it is, what you think it is, because we're not allowed to give advice here on television, but this is what what you think. What's next steps for Wendy? What would you suggest?
Well, I mean, because Wendy, I'm not your doctor, I can't talk about the medication angle, whether you could switch or go off or something like that. I mean, that's something that you'd have to talk about with your doctor. But if you thought in any way that the obsessional thinking was addiction-like, in the same way that your previous addictions was, then I would really suggest that you apply the same principles. Find out what the trigger is, and I'll just give you a really big clue here. It's almost 99.9% sugar, plus other things, and then abstain from that in the same way that you abstain from alcohol. It doesn't sound pleasant, but believe me, when that obsessional thinking drops or goes away, the serenity is far better than the sugar.
So some great information for thought, and although, like I mentioned, we're not allowed to give advice here, we can also suggest, though, that you go and see your medical doctor. So that's great. Wendy, I hope that has helped for you. Our phone lines are lighting up, Dr. Tarman, which is great to see, because we've got, fantastic. So let's go on to line 5 now. Mike's calling from Mississauga tonight. Hi, Mike, you're live on Living Clean.
Yes, hello there.
Hello.
I'd like to know what happens to a person's body with the molecules if they start abusing alcohol.
Did you get that, Dr. Tarman?
Yeah, can you elaborate flesh out that question a bit more?
Like, what is happening to a person's body, you know, if they start abusing a bit, you know, like 3 days a week? Does the body start shutting down, or?
Well, I mean, there's a whole lot of things that are happening with alcohol. So if we're talking about like what's happening to the brain or what's happening to the liver, what's happening to the pancreas, there's like, alcohol is what we call a global phenomenon. It affects the body on many different levels. What are you particularly curious about?
I'm just curious about, like, if a person has a bit of high cholesterol, how is this affecting it?
The cholesterol over time will go up, or the fats will go up. Primarily, alcohol is, if you don't know already, is like 80% sugar. There's a lot of calories in alcohol, a lot of sugar in alcohol. So it's going to affect the liver and the pancreas from the get-go. The other thing is that alcohol does change the fat content in your body. I mean, when alcohol is broken down, you're talking about chemicals or molecules. When alcohol is broken down from alcohol into just carbon dioxide and H2O water, there's a middle molecule called fatty acids that make the liver, we call fatty liver, an enlarged liver, and will also give you a lot of high cholesterol. So if that's what you're talking about, it can do that over time, depending on how many times in a week you're drinking and how much you're drinking each time. We have a standard, what we consider safe drinking for men, which is no more than 2 drinks a day, or no more than, I think it's 8 drinks in a week. I don't know, so don't want to ask you your circumstance, but
yeah, that gives us some excellent information, and I think that was answered very well. It's interesting to see, you know, how it affects the different organs in the body. So there you go, Mike. Yeah, there was one other thought.
Well, and if you're drinking more than 2 drinks in a day or more than 8 in a week, then that's that process whereby your cholesterol can go up, your blood pressure can go up. Your sugars, you can eventually become diabetic. All those things can start to happen. And you know, long-term things like possibility of getting a stroke or a heart attack, those things can all happen if you're drinking more than what we consider safe guidelines. Like I said, 2 drinks a day for a man and 1 drink a day for a woman.
We're taking live phone calls here on Living Clean on CTS. That's what you're watching on this Sunday night. We're going to be back with Dr. Tarman, who is Medical Director of Renaissance here in Toronto. But she is here live tonight, right across Canada, and answering your questions. Do you have a question about any addictions, substance abuse? You're looking at the right place to call in and ask your questions. We're going to take a short break. We'll be right back.
Is someone else's drinking affecting your life? Does it make you feel angry?
Don't yell at me because you're mad at your mom. She's the drunk, not me.
Does it make you feel sorry for yourself?
Hey, Tanya's drinking again, and maybe next time.
Or does it even make you feel frightened?
Does Daddy have to drink so much?
No matter how you feel, we can help. We're Al-Anon family groups, and we know what it's like. Just call 1-888-4-AL-ANON. To help them, you have to help yourself first.
Welcome back, everybody. We're here live. As I was telling you before the break, we're talking about addictions, as we do here every Sunday night. Addiction, substance abuse, the root causes. We were also talking at the very top of the show about food addictions, of which Dr. Tarman has a personal experience and journey in. She has developed some workshops that we would like to tell you about if this is something that you're dealing with. So, Dr. Tarman, tell us about your food addiction workshops. The information is there on the screen, but what will people learn when they go?
Okay, well, I have a couple of them, and the first one is held at one of the local churches in Toronto, and it's going to look at, food addiction. What is food addiction? Does it exist? Are you a food addict, or do you know somebody who might be? And what are some solutions? But the focus is going to be on, is there a spiritual solution? Because, with addiction medicine, especially at Renaissance, we look at addiction as being a sort of threefold thing. It's biological, it's psychological, and it's also spiritual. So I'm going to be focusing somewhat on the spiritual angle there. And that's the one that's in September. Coming up. And then on the second one in November, I'm going to be talking with a personal trainer on same subject for myself, talking about food addiction, does it exist, and what are the solutions. And then he's going to talk about his experience as a personal trainer, and his point that he wants to make is, asks the question, are we are we exercising ourselves into obesity?
Which is a very interesting question.
Yeah.
And then you've got a 2-day workshop coming up in January?
Yes. And then for the people who are actually interested in treatment, because you're going to know that, food addiction to date does not yet have an official diagnosis, a medical diagnosis. I think we've all known intuitively that it exists, and you can find it in the writings since the 1970s, but you won't find it in the actual clinical offerings. In the eating disorder clinics, they don't treat the eating disorders or disordered eating as food addiction. And so what the January workshop is all about is to actually introduce, I have a therapist who's a food addict therapist, and the two of us are going to do what we see as, in a sense, a landmark first-time offering of food addiction care in Canada. There are some people in the States who do this work, and we're going to use their model. And by the way, in Iceland, there's an actual a clinic for food addicts, and that's the first one in the world.
Wow.
Yeah.
And for any more information, you can go to Dr. Tarman's website, which is addictionsunplugged.com. Let's go back to those phone lines tonight, because we are talking about all sorts of addictions. Food addiction just being one, but we all know there's many more that people struggle with. Let's go to line 7 right now. Betty's calling from Toronto. Hi, Betty.
Hi.
Have you got a question or a comment for Dr. Tarman tonight?
Yes, I have 3 questions.
Sure. Go ahead.
One is, if you relapse after going to a detox, do they encourage you to go back to that detox or try to find another detox? I've gone to 2, Renaissance being one of them, but I'm wondering if there's other options in terms of going for treatment.
Okay, let's answer that question.
Well, if you're asking, can you go back to the same one, I don't think that's a problem. Sometimes there's an issue of timing. You can't go back like the next week. But in terms of getting back into the queue, the waiting list, that slogan, keep coming back, is pretty consistent for programs like Renaissance or the other ones in Toronto. Don't let that stop you. If you're feeling embarrassed or ashamed, or you think that you're not welcome, I don't think that's the case at all. But you might find that one approach doesn't appeal to you, and you'll want to go to another clinic or another setting to see if that one works better.
And Betty, did you want to carry on with your other questions?
I'd be interested in finding out where I can find out about different treatment centers, as well as I'm trying to find and having a terrible problem finding an addiction psychiatrist.
Finding a psychiatrist is another matter that's pretty hard to do, especially one who's very attuned to addiction medicine. There are addiction psychiatrists, and the only thing I can suggest there is to get on the waiting list at CAMH, the Center for Addiction and Mental Health, and try to work your way through that waiting list in terms of getting a psychiatrist. But there are a number of numbers that you can call for just finding other treatment centers outside of Renaissance, which I'm not sure if you're aware of. There's DART, which is the Drug and Alcohol Referral Treatment Center, something like that. If you just look under DART, you'll find it. There's 211.ca, or you can find it on the internet. They'll give you actual resources. There's a place called Mars in downtown Toronto called Metro, it's M-A-A-R-S, Metro Addictions.
So a double A there.
Yeah, referral services. And you can go for an interview and then they'll talk to you about all the various services that exist as well. So there's a few of those kind of places that then you can find out what the different treatment centers are and what their waiting lists are like and that sort of thing.
That's great. Betty, does that help? I think you said you had 3 questions. Is there another one?
3 cancellations?
No, you said you had 3 questions. Did we answer everything for you?
No, I think that's it.
Okay,
well,
wonderful.
Thank you, Betty.
And were you able to get some of those resources that Dr. Tarman was talking about? We got DART.
Yeah, D-A-R-T.
Yeah, and Mars, so there's 2 A's in Mars,
yeah,
M-A-A-R-S.
Yep,
and the other one?
Was 211.ca. That's actually a really good one.
Tell me about that one. I don't know about 211.ca.
It gives you all the resources, social service resources in Toronto. Now, I'm not sure if it's just addictions focused or not, but it's I would say it's really good.
But it's a resource tool, something for the toolkit that they can use?
It's an entry point, and then you find somebody, and then they'll help you navigate the system a bit more.
So some resources for you there, Betty. Thanks so much for calling in tonight. We're going to go to line 4 now, and calling in from Mississauga is Summer. Hi, Summer. You're live on Living Clean.
Hi, yes, I have a question in regards to opiates and methadone. I'm on, I see a pain specialist, and I'm on opiates for chronic pain. It has been suggested that I might want to use methadone for chronic pain. I have 2 questions. One is methadone as effective for chronic pain as the opiates are? And secondly, which one has the least harmful effect on a child if you're pregnant?
Boy, that's an interesting question. The first question you asked was, is it as effective? And methadone for pain is being used more and more so. The benefit of methadone is that it is longer acting than most of the opiates. It's 24-hour long. But for pain, you might have to break it down into 2 or 3 times a day. And I guess probably the greatest benefit is that it's fairly easy to control the amount that you're taking. And is it as safe? I think it's probably as good as the others. I think it's probably as good. I'm going to say addiction doctors like to use methadone more so because they have more control over the prescribing of it, primarily because it can be used over a longer period of time. Now, in terms of the safety for the child, like if you're going to get pregnant or you're pregnant, any opiate, and one of the things about the pain medications is that they're not as long-acting as methadone. And if you go through withdrawal, which if you're taking an opiate that only lasts 3 to 4 hours, unless you're taking it regularly, a steady state, you run the risk of having sort of minor dips of withdrawal, which are then going to affect the fetus. Whereas if you're on methadone, you're kind of steady. You don't go through withdrawal until 24 hours later. So you don't have those little blips, ups and downs, which then don't disrupt the fetus. So it's probably considered a little safer from a pregnancy point of view, unless you're being really careful about your opiates that you're getting from your pain doctor.
But once again, Summer should probably check with her doctor or a doctor.
Well, for sure. Oh, absolutely. Yeah. Yeah. Especially when we're talking about opiates, because it is such a powerful narcotic.
Yeah. Summer, does that help? Do you have any more questions for Dr. Tarman while she's here?
Well, I've been on them in the beginning, I had a surgery that was botched, and so I have chronic pain for life. And I've been on them almost 5 years. And in the beginning, they were rotating which opiates they were between morphine and Percocet and whatever else. And then I discovered I was getting migraines from the Percocet. We were tracking things down. I'm only on morphine. I have been on morphine for over 4 years, but I'm on a time-released one as well as the 3-hour. So I'm doing both of them.
Yes. Yes.
So I guess perhaps you've answered, Summer, to the best of what you can here on this television show, right?
Yeah. Yes, yes.
So there you go, Summer. We thank you so much for calling in tonight, and keep watching Living Clean, and I guess maybe go and see a medical professional to chart the... It sounds like she's already under the care of a doctor.
Oh, yeah. Yeah, I mean, yes, I'm assuming that you are.
Well, you know, it's good to call in and see what you think as well. You know, Dr. Tarman, I'm very curious. The subject of methadone has been brought up on this program many times. We heard you speak about it a little bit. I'd like to get your thoughts on that with your work at Renaissance.
Okay, well, Renaissance doesn't, we don't deal with people who are on methadone.
No.
I do have my own small practice of methadone, so I'm pretty familiar with methadone, but it's not part of the Renaissance program. Well, what type of questions
I'm just curious. So
you
you mentioned you've got a small practice then, because there's some people that just don't feel that this is the right course of action at all.
And I understand why they would think that. I mean, methadone opens up the potential controversy, and I think the reason why that Renaissance is stepping outside of it is they just want to step outside of the controversy of it. And that is that, you know, what are we doing with methadone? Is it just a substitution, in other words, just another opiate, and how is that helping a person? And in fact, does it not enable them to continue using drugs, versus is it actually helping them get off of drugs? And it's a very controversial area. There is a way to use methadone in such a way that there's a way that I think methadone can be used very appropriately, and that is that if a person wants to, they're taking opiates and they want to stop, but you know, an opiate withdrawal is very, very, very painful. And it's unfortunately just a little too long, and people just can't stomach it, basically. So methadone will help that. And if it's seen as a bridge, you know, you go on the methadone and then slowly taper off as you develop your life as a clean and sober person, you can successfully get on the other end of the line and be clean. Or if you're somebody who is so engrossed in the drug lifestyle, I mean, it's called harm reduction, will at least make your life a little easier so that you won't get HIV and you won't get abscesses on your arms from needle use as much, and you won't be robbing stores all the time, or whatever it is. So there's benefits in that way. What ends up happening, and this is where people get upset, is that they're not, you can get stuck in that middle ground where you're not hurting enough that you want to change, so that you end up getting caught in this lifestyle where you don't try to get clean completely, so you can't get off of the methadone, but because the person still wants to use a little bit.
Yeah.
You know, and that's unfortunately there's a large group of the methadone population that sort of choose that. Say, I'm on my methadone every day, but this way I get to use once a week or once every 2 weeks, and it's like I get my cake and I eat it too. And I think that's probably the crowd that causes the controversy. But on the other hand, I mean, if that's their choice, that's their choice. You know, and the doctor's job is, my job is not to make pass judgment on that. But I think that's where people probably get upset.
Yeah. Well, some great insight there. Thank you so much. That's a hard question to ask, and I thank you very much for your insight into the subject of methadone. We are going to take another short break here on Living Clean. We're talking to Dr. Vera Tarman, the medical director at Renaissance. We will be back. We've got phone calls coming in from Sutton and Ottawa. We'll be taking those and more. Our toll-free lines are open. Living Clean will return right after this short break.
Statistics state that it is likely you know a victim of abuse. It could be a friend, a relative, a colleague. It could even be you. 1 in 3 girls and 1 in 5 boys will be sexually abused before they reach the age of 18. Please give them hope. Help us make it stop. Go to abusehurts.com and give to the Canadian Centre for Abuse Awareness.
We're back on Living Clean, live here on CTS. So glad that you could join us. We're here once a week as we deal with a subject that's a little tough to deal with, but let's face it, it's something that's very prevalent, unfortunately, in society. There's so many people that are struggling out there, and it's good to be able to give people a forum where they're able to express themselves, don't you think?
Yeah, I agree. Yes.
Yeah.
Yes.
Well, Dr. Tarman is here taking your phone calls tonight. We're going to go to line 3 now. Robert's calling in from Ottawa. Hi, Robert. Are you there?
Yes, I am here.
Hi, Robert. Dr. Tarman standing by to take your question or your comment. Go ahead.
Okay, thank you. I'm calling about my father. He's 92 years old. He has extreme arthritis, especially in his hips, which shoots down his leg. And he's been taking strong dosage of tramadol. I guess that's a drug specifically for arthritis, but it's not really doing anything for him. So I've suggested, and he has a doctor right in the it's not a it's a retirement home where he lives. Sees him every Thursday, and so I put it to him that maybe you should go on to the OxyContin. And so he approached his doctor about that, and his doctor said, no, you don't want to go down that path. So then some weeks went by, or a couple of months, and he's approached him again. He says, well, he said, okay, we'll try the slow release tramadol, and if that doesn't work, then okay, we can try the other. I can write you a prescription for the OxyContin. So my question to you is, do you think that would be advisable, or he's, if he was a student going to university, I would not make that suggestion, But because he's 92 years old, I don't see him getting into a lot of difficulties or trouble with addiction and all that. I mean, he's only got a few years left anyway. And then, but from listening to your program, I guess there's other things. There's other things too, like morphine or heroin or whatever that can be used for like really heavy doses of pain, which is the situation he is in anyway.
Well, Robert, let's let Dr. Tarman weigh in on this.
Yeah.
Your thoughts?
What I hear you saying is that your father is, he's a fairly elderly man, and that the concern about worrying about some of the concerns that we have about the prescribing of OxyContin, is the person going to abuse it? Are they going to get addicted? Are they going to sell it? I mean, I don't think those are concerns that you're having with your father, and I think that. The nursing home doctor is probably weighing, I mean, there's pros and cons to opiates, heavy-duty opiates. He's probably choosing the tramadol because it's considered lesser of a danger than the OxyContin, because he's got to deal with issues like constipation. When you're taking opiates, you get massive constipation, and that's not pretty. That's just not very nice, especially if you're not able to get around and do the other things that keep people regular, basically. I mean, he's got arthritis. It doesn't sound like he has a lot of mobility. So there's that as a concern. There's other side effects. There can be some sedation, over-sedation. I don't know what the health of your father is like, but you want to be careful when you're doing heavy-duty doses that you don't suppress the person's ability to breathe. I mean, there's other factors that nursing home doctor has to consider. And my guess is, because I don't know the medical condition of your father, he's trying to weigh the pros and cons of both of, like, he's not just dealing with the pain, he's dealing with the rest of your father's body too, if you see what I'm saying there.
So best to keep consulting with a nursing home doctor.
Yeah, it's not just the pain that's the problem.
Yeah. We had a lady call in last week about OxyContin. She also, not a young whippersnapper, but she had been prescribed 3 a day. And she was so worried because she'd been on it for a while.
Yes.
And her question to our specialist at that time was, Am I addicted? Can I get addicted? How much do I need to worry?
Well, that's a really good question. You know, what's the difference between addiction and dependency? And I don't know how long she had been taking those 3 a day, but chances are, if it had been more than 2 or 3 weeks, she actually was dependent, which would mean that if she stopped, she'd get some of the withdrawal effects, even if it's just a little bit of flu-like feeling. But is she actually addicted is a different story. And you know, what's the difference? It's got to do with, that's the behavioral piece. That's why people probably think addiction was a moral failing, because there's all this morality of behavioral stuff around it. You know, people selling their prescriptions, people lying, people wanting more than they were supposed to get, all that stuff. And if she wasn't doing that, I would say no, she wasn't addicted, but she was probably dependent.
So another perspective on the use of OxyContin, or things that are cut with it, oxycodone and other things like that. Yeah, that's a tough one. Robert, I hope that insight was a little helpful for you as you talk with the best possible care with that nursing home doctor for your father. We thank you for calling in. We're going to go to line 2 now. Our caller is from Toronto, and I've got a question for you, caller. Is it Megan or Megan? How am I supposed to say this tonight?
It's Megan.
Megan, thank you so much for calling in. I'm running out of time tonight. Can you tell us your question for Dr. Tarman?
Well, I was just wanting to ask Dr. Tarman, since I've gotten out of Renaissance, I find myself snacking a lot at night at the end of my day, where it's like chips, ice cream, bottle of pop. I was curious if like maybe eating a later meal might help me cut that down, or kind of what you might suggest.
Okay, well, I'm going to tell you what I'm going to give you a suggestion, and you can see how you feel about that. I mean, if you're doing, it's like our caller earlier, if you're finding that you're having the same kind of obsessional thinking with your food as you were with your previous drug, has the addiction just shifted over? And you know, it's a very likely possibility. An alcoholic to become a food addict, it's like 40%, 40% more likely to develop a food addiction. It's very likely. No, eating later at night would not be the answer. I think that if you were to identify yourself as a food addict, you'd have to identify what is the trigger food, in other words, sugar or starches, and stop eating those, and then keep to a very strict diet, which would, and I don't mean diet by cutting down on your calories, I mean diet by watching what you're eating. But still eating healthily, like with vegetables and fruits and proteins, but eating at specific times, and maybe even weighing and measuring your foods, and treating your food as carefully as you treat your sobriety in your previous drug of choice.
What about the late night business, though? Because that catches everybody. I don't think you even need to have a food addiction. It's tough at night.
Yes, that's right. Well, it's tough. It's tough at night for 2 reasons, because you develop a pattern. It biologically is not tough at night. The body doesn't actually want to eat at night. It wants to wind down, digest the food that should have been eaten earlier in the night, and then wind down. But we make it tough because we develop a pattern of eating, and we develop that expectation. So there's that kind of psychological phenomena. But then there's also the, you're coming down, if a person has eaten a high sugar load or a high carb load, you're starting to crash. And right when you're trying to fall asleep, you're starting to essentially go into withdrawal. Yeah, then you're going to want to eat something. People will eat something usually that has a lot of serotonin in it, like bread or chips or pasta, because it makes them sleepy, because they're needing that little bit of serotonin boost.
That makes sense. Megan, I hope that helps you tonight. We're going to go to line 5 now. Pam's calling in from Willow Beach. Hi, Pam.
Hi, how are you this evening?
We're doing well. Thanks for calling in. Have you got something to ask Dr. Tarman?
Yes, I do. I know that Suboxone is new in Canada, and my question is
Pam, go ahead and express yourself. I think if you have your TV, we have a bit of a delay, so you're going to have to turn your TV down, Pam, or just ask the question.
My question is, what would you recommend, Suboxone over methadone?
I don't know your story, so I can't really comment specifically. You're right, Suboxone is relatively new to Canada. It's actually relatively new to the opiate scene. It's considered, if your opiate debt or your opiate addiction is not that high, it's considered an easier drug to get off of. It's considered easier to manage, and so in a sense, you're not, it's addictive in the same way that methadone is or other opiates, but it's considered a little easier to be on that program and then to get off of it. So it's considered a better drug if you don't have to go to the harder hitting methadone program.
I haven't heard of this one. How long have we seen it here in Canada, roundabout?
I'd say maybe 2 years,
yeah.
2 or 3 years. We've been talking about it for a long time, but it hasn't been approved. It's been around in Britain for a long time.
And so overseas.
Yeah, yeah, and people have really liked it because it's when you're on the methadone program and you're trying to get off, those last few milligrams can be really hard.
Yeah.
Whereas with Suboxone, it seems to be much easier and people just get off of it. There's a safety profile too. You can only take so much. You can't overdose on Suboxone. So it's considered to be a safer alternative if you qualify basically for it.
But it hasn't yet been approved here in Canada.
It has been approved
just now, yeah.
But and doctors have been prescribing it. I don't think longer than 2 years. Probably most of them in the last year.
Oh, okay. Yeah. All right. I'm glad that we cleared that up. So yeah. Well, I hope that answers your question for you, Pam. That's going to wrap up all of our questions here on Living Clean tonight. We thank everybody that has called in. We have a few other things to talk to you about just before we go. So stick around, folks. We're going to take a short break, and we'll be back to wrap things up with Dr. Tarman right after this. It's been a great evening here on Living Clean, and we thank you so much for talking to us tonight, for having that courage to pick up the phone and ask the questions. Dr. Tarman, it's in your work, you know, we were talking about, you know, the fact that, you know, there's a lot of people out there that are asking questions. It's nice to have a forum like this on television where people can annonously, if they want to, phone in. What do you think about a forum like this?
I think it's a great idea. Yeah, for sure it is. Yeah, because every question that's asked, there's 10 people who are asking the same question, who are either too afraid to ask or they just think, oh, you've just asked that question for me. Yeah,
often, you know, we get a lot of phone calls, but I know there's so many other people out there listening. Don't forget about Dr. Tarman's food addiction workshops that she's got coming up. You can get some information for them on addictionsunplugged.com. That's your personal website, isn't it?
That's right, yeah.
So addictionsunplugged.com is the place to go. If you want to even contact Dr. Tarman, people can actually go on there, and is there a contact button there?
There's an email address that you can get a hold of me, and there's also a phone number there too. And there's also lots of articles on food addiction and eventually on other addictions as well. So it's a good resource as well for information.
And just in case you missed it right off the top of the show, Dr. Tarman is medical director at Renaissance, but she is also someone that has come through the area of food addictions and is celebrating 105 pounds that she has left behind. That's a tremendous accomplishment.
Yeah, more than 10 years ago.
Wow, that's outstanding. Dr. Tarman, we thank you so much for joining us here on Living Clean.
Thank you.
And once again, folks, it's been great to talk to you tonight. We will see you again next week right here on Living Clean, Living Well. I've got to tell you, coming up in September, it's going to be very exciting here on the show when we've got a brand new set coming and lots of more exciting things coming your way. I will see you next week. Stay tuned. Bye-bye.
Thank you.
Living Clean has been brought to you by Turning Point Detox. Living Clean is a presentation of the Canadian Centre for Abuse Awareness.
Hi, Lindsay Roberts here, and I want to tell you we've got our brand new online magazine up, and now we've got the next issue ready to go. Make Your Day Count. I believe this will be a blessing. In this issue, you're going to hear Doing What Mama Says by Oral Roberts, Go to the Throne Before You Go to the Phone, Lindsay Roberts, Minding Your Own Business, Colleen Rickenbacker. To get online, all you have to do is go to makeyourdaycount.com, and I believe it'll bless you.
Make your day count. Make the most of every minute. This is your day to shine. Make it count. 'Cause when we're fully in it, we can make a difference in each other's lives. This is the day. Make it count.
Hi there, welcome to Make Your Day Count. I'm Lindsay Roberts, and today on the program, I want to talk to you about a tiny little sheet of paper I found with my father-in-law, Oral Roberts' name on it, with what I consider to be a pretty good big revelation. And it's from